To all who are new here, my name is Dr. Michelle Henney, and I'd like to welcome you to Releve Sports Medicine's virtual journal club. We are looking for an athletic trainer to join our team. This is a combined position working in a sports medicine clinic and at an NAIA university. Please feel free to pass our information along if you know a qualified candidate. More information regarding applying can be found on our website. For additional webinar educational opportunities, you can visit our website and register directly for the webinar or sign up for the email list to be notified of upcoming webinars. We are continuing to update our schedule, so check back often. For all athletic trainers who are intending to get live CEUs from the BOC, you will receive an email 1 hour after the webinar concludes, which includes a link to the combined quiz, evaluation, and assessment. You will have up to 72 hours to complete the quiz and the evaluation. This email will come from customercare@gotowebinar.com. Please ensure that this is done to receive your statement of credit. If you don't receive the follow-up email or you have any other concerns, then contact us via our email at journalclub@relevesportsmedicine.com. Once the statement of credit is available for download from our website, you will receive an email notification. If you have any questions during the webinar, please submit the question and we will review questions at the conclusion of the presentation. If you cannot see the PowerPoint slides and you're accessing the webinar from your mobile phone, swipe the screen to the left or to the right and the slides will become visible. The recording will be available for review from our website tomorrow. Our speaker this evening is Dr. Kathryne Bartolo. Dr. Bartolo is an assistant professor in the Department of Physical Medicine and Rehabilitation at the University of North Carolina, Chapel Hill School of Medicine. She earned her medical degree from Drexel University College of Medicine and completed her residency training in physical medicine and rehabilitation at Rutgers-New Jersey Medical School, Kessler Institute of Rehabilitation. She then completed a fellowship in sports medicine at NewYork-Presbyterian Hospital, the University Hospital of Columbia, and Cornell. She is board certified in physical medicine and rehabilitation. In 2009, Dr. Bartolo was awarded an International Fulbright Fellowship to conduct research at the Institute of Food Science in Avellino, Italy. Her current professional interests include sports medicine, diagnostic and interventional musculoskeletal ultrasound, and esports and gaming health. And she's going to speak with us tonight about a really exciting topic, which will be an introduction to esports for athletic trainers. And I'll let her take it away.
Good evening, everyone. I apologize, my camera is having a bit of a glitch, so I won't be able to be on camera with you today, but I'll be here still with you auditorily. So thank you so much for that wonderful introduction, and thank you very much for inviting me to speak as part of the Journal Club series. It's a wonderful series, and I'm honored to be a part of it. So tonight we'll be exploring the new frontier in the world of esports we'll be exploring a new frontier in the world of sports medicine, which would be esports. And this is a topic that is near and dear to my heart. And I've really been pushing to make this a larger topic within the healthcare arena as well as in the esports community. And I currently was just appointed as the physician advisor for our UNC esports team here where I'm working. So I'm really excited about that. So let's dive right in. Okay, so I have no conflicts of interest or financial relationships to disclose. Just give you a moment to read this slide here instead of reading it to you. Okay, so esports 101. What are esports? So esports stands for electronic sports. So it's competitive, organized video gaming. So esports can be, you can compete in esports as either a team, most often as a team, but you can also do so individually depending on the game. We'll review some popular games a little bit later in the presentation. Games are played on a console, so for example, PlayStation or Xbox, or on a computer-based PC. Most gamers game on PCs as opposed to Mac computers. They tend to have slightly higher processing speeds and are built for the amount of data that runs through when they're playing these large games. And then additionally, you can play with a controller or with a keyboard and mouse. You can use a controller when you're on a console, and you also can use a controller when you're using a computer-based game. A little note, fun fact about esports and popularity and where we're moving. It was announced this year that esports will represent 8 medal events in the 2022 Asian Games. So the Asian Games, for those who are not familiar, is a continental multi-sport event held every 4 years among athletes from all over Asia, and it's the second largest multi-sport event in the world behind the Olympics. So this is an exciting move forward. So about levels of competition. So just like other sports, there you can play esports at various levels of competition. So it can start as young as high school, where there's official leagues for high school. Then at the collegiate level, there's intercollegiate teams, and we'll get into that a little bit later, as well as professional teams where they're playing on nationals or in world championships. And then there's the amateur circuit, where they don't quite fall into that umbrella of a high school team or a collegiate team, but they're not a professional and they're not being paid for playing esports, so they fall into that amateur bucket. So for high school sports, in 2018, it was a large move for the National Federation of State High School Associations. They recognized esports as an official sport. Currently, there's over 8,600 high schools with teams in the US, and there's a lot of support from companies like PlayVersus and the high school esports leagues that have resources for schools that are interested in implementing esports programs at their high school. So if you are currently an athletic trainer or working at a high school that might be interested, these are some companies to explore. Go to their website, reach out and see if they can offer resources to help get a program at your institution off the ground. And then at the college level, there is the National Association of Collegiate Esports, also referred to as NACE. So NACE is the largest member association of varsity esports programs at colleges and universities across the US. It's a nonprofit organization. And recently, this past July, NACE partnered with CSL Esports, as well as Nerd Street Gamers and a couple other companies, to create the NACE Star League. And this is going to become the largest collegiate esports league in North America and will encompass more than 14,500 students from 600 colleges and universities. So this is a big move because it's bringing together some smaller, NACE was always the larger league, but some other smaller leagues to bring them together so that everyone's competing essentially like the NCAA. And just a little shout out to my UNC Chapel Hill esports teams here. It's their logo. While the esports are not currently recognized by NCAA, it has been the topic has been broached. They've considered it. I haven't quite followed through on that yet, but esports teams are starting to be welcomed into athletic departments. So in certain different universities, you'll see underneath the list of the teams, esports is sitting right there. And so perhaps some of you that are on the webinar tonight are from those types of schools, and perhaps that may have drawn you to this talk to learn more about it. So NACE has over 170 member schools comprised of over 5,000 student athletes. And which is great here is that there's over $16 million in esports scholarships and aids to help recruit these collegiate esports players to these programs. And I think that's awesome that we're trying to bring in that talent and that there's support for that. So some popular games that are often played in competition. Some of you might be familiar with League of Legends. League of Legends tends to pull some very high viewership when it comes to the World Championship. We've also got Counter-Strike Force Global Offensive over here. We've got Dota 2, which is Defense of the Ancients, Fortnite, Super Smash Brothers, Valorant, Apex Legends, Rocket League, Rainbow Six Siege, Overwatch, and Call of Duty Warzone. So just a very brief, overview of some esports vocabulary. Mostly just wanted to make sure that if you encountered one of these players in the training room or they were exploring coming to the training room, that would be good terms to be familiar with. So there's different types of games and they fall into these different categories. So you've got your first person shooter, you're essentially in that first person point of view, and that third person shooter, where it's a variation of that, but obviously it's more of third person. And we've got the multiplayer online battle arena, which is called a MOBA. And that is what League of Legends is, where you've got lots of players playing in this kind of team-based battle. And we've got role-playing games and real-time strategy sports games. So a couple of terms to be familiar with is a scrim, which stands for scrimmage, which we're all familiar with from traditional sports, which would be a practice game as opposed to competition. GG is often used to say good game, expressing good sportsmanship at the end of a game or to concede when losing. It's also used very colloquially around the gaming circuit when they're just talking about other things. And then tilt is when a player is playing badly or without confidence, usually due to anger or frustration. This is a term that actually comes from poker. And it's just a good term to be aware of, that if a player is talking about it, it might clue you into there might be some mental health concerns going on. There might be some mood disorders going on, just to be aware of that. So demographics, still predominantly male. There's definitely been a push lately to be more inclusive and draw in more females, but as of now, it's still predominantly male. Average age is about in late teens to the early 20s. Daily time spent playing esports has quite a range. So anywhere from 4 hours to 15 hours. 15 hours is definitely on the high end. That was reported out of some teams in South Korea. The majority of them are non-smokers, and on average, they have a normal BMI. So this is important because a lot of times we think of esports athletes of being, potentially less healthy or something like that because they're more sedentary. And in some ways that may be true, but it doesn't necessarily mean that they're all obese. Anyone who's familiar with that famous South Park episode where he's playing World of Warcraft, he was a larger character, and it kind of gives this stereotype that all gamers are going to be obese and they're eating poorly and things like that, but that isn't necessarily the case. So the skills involved with playing esports, I like to think of esports athletes as small muscle athletes. So a lot of the skills they're using here are similar to skills that you'll see in other sports that are sanctioned, in the Olympics, such as archery, shooting, and curling. So it requires a lot of hand-eye coordination, a lot of mental endurance for these long games. They can last, anywhere from 20 to 40 minutes, and they can play multiple sets, like 3 out of 5. And so they really need to stay on because there's a large cognitive component. Teamwork. So you'll see a lot of team-based esports played where the players are wearing headphones with microphones, and they're talking constantly with their team to make sure that everyone knows what's going on the board. Lots of fine motor movements. As I said, they're small muscle athletes. Lots of spatial awareness as they're moving within a 2D map or a 2D world, and creating motions out here in the real life. And then we're seeing a lot of repetitive movements, and reaction time is huge. We'll get to that in a few minutes when we talk about actions per minute, but reaction time really can make or break how well you're able to perform. So a little demonstration here of actions per minute, which is referred to as APM. So each mouse and keyboard input is considered one action, and pro players have been measured to basically get upwards of 400 to 600 actions per minute, or APMs, when they're playing. So StarCraft was pretty famous for the amount of APMs people use. So just show you a quick little video here of what that looks like here. And this isn't artificially sped up, and these are all purposeful movements that he's making when he's playing this game. Moving on here. Okay, so now let's move on to exploring certain areas of injuries or considerations when it comes to the health and wellness of esports athletes, as you may be seeing them in training room or working with them with their teams, whether or not it's in the training room. So first, we'll explore musculoskeletal considerations. So there's many risk factors for MSK injuries in esports players. So some of these are those repetitive movements. We know repetitive movements can lead to overuse injuries. They predominantly are using small muscle groups, as I mentioned before, and these are muscles that don't tend to be addressed in your average strength training program. So they may be on the weaker side. They're not necessarily accustomed to this type of overuse or this type of degree of use and the repetitive motions. Additionally, sustained aberrant posture. So they're staying seated for long periods of time, but if they're in a bad posture with bad body positioning, that can result in other issues, as well as just static body positioning. They're not moving. If you're staying in one spot, that can cause problems as well. Suboptimal ergonomics, you're not set up properly, and possibly body composition, which I'll touch on a little bit later. And when it comes to static body positioning and just the sedentary nature of this sport, one study found that more than 15% of college esports players played for more than 3 hours without a single standing break. So that's just a recommendation right there, is that whenever there's an opportunity for a break between games or scrims or such, to try to stand up, try and move around, try to reposition your body, and encourage your players to do that. So common sites of musculoskeletal pain, there's been 2 larger studies looking at this, and the top site seems to come out being the low back, or the back in general, then closely followed by the neck. Other common sites of musculoskeletal pain are the shoulder, the wrist, and the hand. And one study found that upwards of 42% of the respondents had musculoskeletal pain in the previous week. And what I thought was interesting here is when we look at the number of musculoskeletal pain sites, according to one of these studies, we see 32% had one site of pain, but the majority over here had 2 sites or more of musculoskeletal pain. So this clearly is an issue among this athlete population. A little bit more about sustained aberrant posture. So showing this in real time, this is a common posture we see in people when I'm in my clinic, even if they're not necessarily a gamer, if they're working on a computer, but also on our phones. We do a lot of things in front of us and kind of close in front of our bodies. And so this causes this kind of protracted shoulder head forward posture, which is typically referred to, or I like to refer to, as upper cross syndrome, which we're going to get to in a minute or two. Sustained aberrant postures can also cause issues with intervertebral disc dysfunction. It can load those posterior elements of the spine, particularly the facets, and cause pain there, as well as causing a radiculitis or radiculopathy, as well as pectoralis minor syndrome. So this happens with the pectoralis minor gets tight due to this upper cross posture with the protracted scapulae. And as the pectoralis minor gets tight, you've got the cords of the brachial plexus passing under there, and it actually can become taut and compress those elements of the brachial plexus and lead to symptoms further down in the arm, including pain and maybe some weakness and numbness and tingling and things like that. So upper cross syndrome, as I mentioned before, which we'll refer to as UCS here, was originally described in the 1960s. It's pretty common, as I mentioned, postural abnormality due to muscle imbalances in key antagonists in the upper body, in the neck and the chest. And so the imbalance here is the reason why it's called a cross is that we've got the hypertonic or the tight shortened muscles here, so the upper trapezius and the pectoralis muscles in the chest, and then the other cross represents the hypotonic or the weak lengthened muscles. So we've got the deep neck flexors in here, and we've got the rhomboids and the lower trapezius over here. And so this is how it's classically described. You've got this increased thoracic kyphosis and the increase of the cervical lordosis, and it's just moving. All of the muscles are a little bit out of whack, and you're getting sometimes impaired scapular thoracic motion, and it can cause a lot of pain in various regions up here in the neck and the upper back. So a common way to treat this, a recommendation that I have, is to do low rows. So over here on the left. So studies have shown that exercise programs to correct posture can improve pain related to impaired posture. And so we want to make sure that we're doing the low row because this is targeting our rhomboids and our lower trapezius. We want to avoid this form here with the high row because this is targeting the upper trapezius, which usually is already tight and hypertonic, and we want that to relax. So instead, we want to target the lower trapezius and the rhomboids with this low row. A little bit on intervertebral disc dysfunction. So many studies have shown that sitting increased intradiscal pressure, especially with forward flexion, especially, you know, that you've seen here when you're sitting with bad posture or worse posture, right? When you're sitting up straight, it's not quite as much pressure on the disc, but then when you're sitting more slouched, it's increased pressure. And this was then basically repeated in this other study that agreed with the prior findings. Additionally, there was an in vitro study found that showed that static disc overloading actually led to a predisposition to herniation. So as opposed to dynamic loading, when you're like doing a traditional sport and you're like cutting or you're loading or you're moving quickly and you're causing a disc herniation, and instead when you're more sedentary and that static disc overloading actually increases your risk of a herniation. And so this has been postulated as a mechanism for the increased prevalence of lower back pain and herniation in younger individuals that live a more sedentary lifestyle, such as gamers sometimes. So recommendations for treating this or also preventing this is core stabilization programs. I personally like the McGill Big 3 exercises shown here on the right. For core stabilization, we've got the curl up, the bird dog, and the side bridge. In my clinic, I recommend these to a lot of my patients and have had a lot of success with this. Other common peripheral pathology, so overuse tendon pathology, so subacromial impingement syndrome or mouse shoulder, where you're basically your body, your elbow's too far out, and so as a result of that, it's not close enough to your body, you're causing an impingement syndrome. And lateral epicondylosis, we see decurving tenosynovitis or gamer's thumb, where you're seeing inflammation of the tendon sheath in the first dorsal compartment of the wrist, of the thumb. Additionally, we can see peripheral nerve entrapment. So I commonly see cubital tunnel syndrome or carpal tunnel syndrome in the gamers that I'm treating. This is usually due to, for the cubital tunnel, due to compression, so that they're leaning on an armrest or a desk or something like that with their mouse hand, as opposed to carpal tunnel syndrome, which actually seems to be due to the overuse of the finger flexors within the carpal tunnel, causing crowding and irritation around the median nerve passing through there. A word on ergonomics. So it is important to try and optimize the gaming setup, particularly for computer-based games. I really enjoy using this computer workstation ergonomic self-assessment checklist. It's very accessible. You can give this to your players, and they ask them questions about their chair and the height of their desk and the placement of their monitor and things like that. And then they give suggestions, you know, if you're saying like, no, it can't do that. Okay, this is a suggested action for how you can improve the ergonomics. But it's really important to note there's been a lot of studies on the effect of optimizing computer ergonomics in office players, not necessarily gamers, but in office workers who are using computers. And optimizing ergonomics is only part of the solution. It's not a fix-all. So studies have shown that when you improve the ergonomics of the computer setup, it may have had some effect, but some studies showed that there was no effect at all. And it was more partnering the improvement of the ergonomics of the computer setup with an active exercise strengthening program that actually showed an improvement in musculoskeletal pain symptoms and conditions in computer users. Once again, this was in office workers, but we can try to extrapolate into our gamer population because there is a lack of original research at this point, though improving in the gamer population. So barriers to care. for this patient population or this athlete population, the majority of players are not seeking medical attention for these issues. One study showed that only 2% of college players sought medical care for musculoskeletal complaints. Then there was another study out of Germany that basically showed that only about 26% of gamers or esports players were seeking health care or medical care of some sort for their musculoskeletal complaints. And you can see the breakdown here. Some of them were seeing chiropractors or physical therapists. Some were seeing their general practitioner, and there weren't really any going to specialists. So this definitely points to a gap here that we need, maybe it's from one end that there's poor education on the importance of addressing these issues. Our traditional athletes get hurt more often, and I think it's more part of the culture that there's going to be injuries, and then you're going to rehab those injuries, and you'll return to play. And that may not be a huge part of the culture in esports, not yet anyway. But I think it also comes from the standpoint of the healthcare team and the athletic trainers and the doctors and the nurse practitioners and the physical therapists presenting a welcoming front that these players, that we do recognize the skill it takes to perform their sport, and that we're here for them as a resource to help treat them if they're having issues and help return them to play and try and optimize their performance. A word on body composition. So we talked about how a lot of gamers actually have a normal BMI, and so there was a study looking at this at other body composition parameters, because the thought was that it's possible to have a normal BMI when you're a sedentary individual, but have other health markers be abnormal. And so this study looked at college esports players and compared them to age-matched controls. And keep in mind, this was a smaller sample size, but they did show that the college esports players had higher body fat percentage, lower lean body mass, so muscle, and lower bone mineral content. So we'll take this overall with a grain of salt. We're not going to apply this as gospel, but it does give us a little bit of an inkling of things to be aware of. And this might predispose them to injury if we start recommending traditional strengthening programs and aerobic programs that they, might have a slightly lower bone mineral content. Are they at increased risk for stress fractures if we start them too quickly on a higher impact aerobic program? We don't know the answer to that. Or are they more at risk for having musculoskeletal complaints? One, because of overuse with the repetitive motion, but also because they maybe have less muscle, or it's less hypertrophied muscle, it's smaller. So things to keep in mind moving forward, and potentially other avenues to explore with research in the future. Now we'll move on to medical considerations. So the first thing to touch on is eye strain and eye fatigue. So there's a condition called computer vision syndrome. It's also referred to as digital eye strain, and describes a group of eye and vision related issues that results from prolonged electronic screen use. So you can see some symptoms listed here. Depending if it's extraocular outside the eye or relating to the ocular surface. And these are all of the symptoms that are associated with computer vision syndrome. Interestingly enough, ahead of musculoskeletal pain, the top complaint in the study surveying college esports players actually was eye fatigue, and that was even before back pain. So clearly, eye fatigue and eye strain is a real issue in this athlete population, and the risk factors for this are pretty obvious. Prolonged screen time. Other things to consider is they might have an uncorrected refraction error. Do they need glasses or contact lenses, and they've never had their vision checked and it's uncorrected, and so it's causing eye strain because their eyes having to work even harder when they're spending all this time on the screen to focus when it could be corrected with a lens. Additionally, suboptimal ergonomics could be contributing. So, for example, sitting too close to the screen. According to OSHA recommendations, the preferred viewing distance from the eye to the front surface of a computer screen is generally between 20 to 40 inches or 50 to 100 centimeters. So perhaps if it's too close, it's causing too much strain with focusing, so we want to try and optimize that as well. other treatment and prevention opportunities for computer vision syndrome. So we mentioned improving ergonomics. You can use artificial tears to help with the dryness that can happen. We don't tend to blink as much when we're staring at a screen. There's also the implementation of the 20-20-20 rule. So taking regular breaks, and about every 20 minutes, according to these recommendations from ophthalmologic associations, is that every 20 minutes of electronic screen use, you should look at an object or structure 20 feet away from you for about 20 seconds. And this will then allow the eye to relax. This suggested time frame may not be practical for certain esports or certain games, but the general concept applies and should be integrated into natural breaks within gameplay. So, you know, you've ended a game and you've got a, you know, break in between restarting the next game to then take this opportunity to look at an object or structure 20 feet away for about 20 seconds. And so it doesn't have to be quite at that 20-minute cutoff, but just incorporating that can improve symptoms of CVS. And this was demonstrated by a study looking at college students. They were not esports college students, but they were just college students who had a high amount of screen time. And it showed a decrease in the frequency of CVS symptoms with regular use of the 20-20-20 rule. And then there's this topic of the blue light filtering glasses. So there's been a bit of research into this. There's several different studies, and overall the research is controversial. Some showing that it can improve eye strain symptoms, others showing that it doesn't have an effect. Overall, from looking at the research that's currently out there, I'd say the enthusiasm currently outweighs the evidence, but there's no indication of harm of using them aside from potentially the cost of buying them. So you can try it. I just don't think that it should be looked at as a cure-all for eye strain, and that we should look at these other examples that I talked about of regular gaze breaks, making sure we've corrected any refraction error, fitting glasses, using artificial tears, and optimizing the positioning of the monitor before we rely heavily on the use of blue light filtering glasses. Now onto the topic of stimulants. So performance enhancing substances, we're no stranger to that in the world of traditional sports medicine, but esports is no exception to this. So caffeine use is very common among gamers. There was a study in 2013 that came out and was looking at gamers and esports players, and 74% of respondents reported using caffeine, and it's the most commonly used substance among gamers. But more concerning is the widespread use of Adderall and Ritalin among esports players. So there's no documentation of this in research. Obviously, it's for obvious reasons, it's a touchy subject. But when you listen to the community and from anecdotal stories, it's used quite frequently. And so there's a lot of considerations for this from the standpoint of fair play. So, you know, performance enhancement as well as health considerations. So in general, symptoms of excessive stimulant use, whether it's caffeine or energy drinks, which tends to be the most common route of caffeine consumption among gamers and esports players that I've seen, or if it's a prescription stimulant, we can see symptoms such as insomnia, anxiety, restlessness, palpitations, cardiac arrhythmias. You can get GI distress, just diarrhea or nausea, dizziness, headaches, hypertension, elevated blood pressure. Additionally, with the use of prescription stimulant, there's also rare but severe adverse effects that we need to be aware of, and those include stroke, heart attack, sudden cardiac death, seizures, and psychosis. So these are things to make sure that you're screening your players for. And then there's the question of regulations. You know, we've got our list of banned substances from the NCAA, and we've also got that at the level of Olympic competition. And so in esports, there's definitely a move towards that. So the Electronic Sports League was the first major esports organization to implement anti-doping code at all of their tournaments and created a banned substance list, but there isn't a generally accepted code at all of the tournaments. And I think that it's difficult to enforce right now. There aren't really protocols in place to assist with that. So this brings me to cardiac screening. So cardiac screening definitely has come to the forefront in the time of COVID with our athletes when we were talking about cardiomyopathy, and we were talking about that a lot. And I think it's something we need to consider for our esports players. So there was a study looking at players as they were competing in Fortnite. It was about a 3-hour session with college players. They had normal BMI. And they compared their resting heart rate to their peak heart rate while playing Fortnite. And they did see a significant increase with, resting heart rates in the 70s and then a jump up to a peak of 120 beats per minute. So we are seeing physiologic stress response being elicited from esports gameplay. So if we look at this in conjunction with the knowledge that many esports players are using either caffeine or prescription stimulants for presumably to improve cognitive function and wakefulness, perhaps also for prescribed reasons, perhaps they have ADHD, but either way, they are having a peak heart rate that is in creating that stress response. So we need to make sure that we're asking those routine cardiac screening questions as well. And this study wasn't even in true competition, it was simulated competition. So I imagine this could be even higher in a high stress situation like a championship game. So we need to make sure we're asking about family history of sudden cardiac death, any personal history of syncope, any personal history of experiencing palpitations, dizziness, shortness of breath with exertion, even if it's just going upstairs, symptoms of chest tightness or pain. These are similar questions that we're used to asking our traditional athletes as well to make sure we're screening for any high-risk athletes. Additionally, we need to make sure we're asking about stimulant use. It's a real thing and we know it's there, so we need to make sure that we're asking our players, asking about their consumption and seeing, are they having symptoms of insomnia or higher anxiety or things like that, screening for higher blood pressure in these players to make sure that we're not missing potentially red flags of a sign of a severe problem down the road. And now we'll touch on mental health and lifestyle considerations. So sleep. So sleep disturbance is common among esports players. There was one study that showed that up to 50% of esports players had sleep disturbance. So poor sleep can lead to impaired cognitive function, which then can lead to diminished performance because esports require a high level of cognitive executive functioning. And so possible contributing factors for why they're having poor sleep could be exposure to white light emitting screens for long portions of the day, perhaps close to bedtime, high stress and anxiety related to competition or stimulant consumption causing insomnia or as well as anxiety. So we want to try and encourage good sleep hygiene behaviors, trying to turn off white light emitting screens about 30 minutes to an hour before bedtime, trying to have a sleep routine that we're going to brush our teeth, we're going to perhaps read, we're going to turn down the lights and things like that to try to encourage good sleep onset and sleep latency. I'll touch on mental health a little bit here. So there is a phenomenon called gaming disorder, which is related to the addictive characteristic of gaming. It's designed by the game developers for you to want to play it more. So it can be addictive, and studies have shown an increased risk of depression associated with persons who have features of gaming disorder. So gaming disorder is recognized by the World Health Organization and American Psychological Association. And just like other addictions, when it comes to illicit substances and alcohol, it's quantified as that once it starts affecting other parts of your life, responsibilities, and things like that. We know that poor sleep increases the risk of mood disorders from studies outside of gamers, such as, depression and anxiety, and gamers are not excluded from this. So you're getting poor sleep, you're more at risk for feeling depressed or anxious. It can be high stress environments, especially at higher levels of competition. I mean, at the pro level, there's a lot of money on the line for these prize pools. in the hundreds of thousands of dollars range. And so that can put a lot of stress on players and give them anxiety as well as depression if they feel like they're not performing. Young age, we often see that mental health disorders tend to have onset in the teens and early 20s. So this is just that population of people who are playing esports. And so just like with other traditional athletes, we want to make sure that we're screening for this and paying attention for any warning signs among our players. Consider professional referral, recommend meditation for players that are feeling anxious or stressed about competition, and also encouraging regular aerobic exercise. Regular aerobic exercise has been demonstrated to be helpful in the treatment of mood disorders, especially depression. And it's a twofold because you're also improving fitness. Then we'll touch a little bit on some research that's out there for helping to optimize performance in esports players. So there was this great study that I love that was published in Medicine and Science in Sports and Exercise, which is the official journal of the ACSM. And so the basis of this study was the knowledge that cardiovascular exercise has been shown to have positive effects on cognitive function, particularly those involved in executive control processes, which include coordination, inhibition, planning, and working memory, which are all integral parts of competition in esports performance. And so mental toughness is also a huge role, has a huge role in esports performance. So subsequently, the authors hypothesized that participating in cardiovascular exercise could lead to improvement in esports performance. So they created this crossover study that basically they took baseline data at the beginning on their outcome measures, and then players were either put in a rest break for 15 minutes or the high intensity exercise on the ergometer for 15 minutes. And then they did that, and then there was this washout period of reading for 20 minutes, and then they did a standardized League of Legends task. And then players would then switch to the other condition. So if they did the rest break first and did the task, then they would switch to doing the hit condition and doing the task. And the results were pretty wonderful. So overall, there was improved performance and accuracy. So we see here the total number of targets eliminated during the standardized task was higher, significantly higher in the exercise group. And their accuracy, denoted by the number of errors, was also improved in the exercise group. They performed a fewer number of errors compared to the group that did the rest. And that was a crossover, so they were able to compare to themselves. And so this suggests the potential for participating in, high intensity exercise before a game to help improve performance before competition, and could help promote regular physical activity within the esports community. If we have this data that says, okay, yeah, exercise is good for you, and we know that it's good for you because it improves your fitness, but hey, it also can improve how well you game. So take-home points. We need to consider extending training room access to esports players. They're starting to be absorbed into the athletic departments, and even if they're not, they are athletes with a unique skill level that need access to athletic trainers who can help them optimize their performance, who can help them make sure that they're getting the necessary medical care that they need for any issues, because we've seen that they don't necessarily seek that out. So we need to make them feel welcome by making announcements or going to teams and saying, hey, you can come here and I'll be able to be a resource for you. We need to, consider pre-participation physicals and evaluations for these players if we're working with their teams. And some special considerations here would be vision screening, making sure to include that cardiac screening that we're also doing for our traditional athletes. Ask about stimulant use, making sure we're screening for any mental health conditions, and that we're encouraging optimization of the ergonomics of a gaming setup, and perhaps providing that self-checklist for gamers to work on their home gaming setup. We want to emphasize improving posture and core strength among gamers across the board. And we want to also promote overall fitness. And so we can do that by, telling gamers that there's some research and some evidence that suggests that aerobic exercise may improve esports performance as well as their fitness. some references here listed for you if you're looking to dive into this topic a little bit more. And thank you so much for your attention. I hope that you were able to learn something and that I've opened your mind, perhaps if you came into this thinking, esports as an athletic trainer, that I hope I was able to open your mind to the possibility and the potential here and the need. So I'm happy to take any questions. And if you would like to get in touch with me sometime after the webinar, 3 different avenues. You can either email me, follow me on Instagram, or this is my Discord handle and you could send me a message on that.
Awesome. What a great talk. Certainly not the typical conversation here, but definitely very relevant. And I know at least with quite a few of our colleges and universities locally, we have been seeing our athletic training departments started to, they always ask the athletic training team, okay, you're gonna also do this and also do that. And now they're saying, okay, you're also going to be taking care of these esports teams. So it's been a big comment, a big question that has come to me from the athletic trainers. Where do I even start?
Oh, that's wonderful. That's great. I'm happy to hear that. And it's really starting to explode like that.
Yeah, absolutely. Absolutely. I know both that one of the local high schools has a team, and then one of the local colleges, the athletic trainers were like, Dr. Honey, what am I supposed to do?
Oh, well, that's great. Well, I hope this helped. I helped some of the athletic trainers here feel like they have a good foundation to start from, at least.
Absolutely. So we've had not necessarily questions, but we've had a couple of comments come in. We have Nadine, who's a frequent attendee of our virtual events. She says, "Go Tar Heels! I'm an '87 graduate from their sports medicine program." Yep. And then Michelle says, not a question, but a thank you for the introduction to esports. I'll tell you, for me, the thing that has been particularly interesting is the terminology that you were going through, the scrims, the GG, the tilting. To be fair, I have no idea how to use tilt in a sentence based on how you playing badly, if it's a verb, noun, an adjective.
Yeah, no, I mean, you could use, it was just like, it's like, maybe we would have won that game if, Brandon wasn't so tilted after, he didn't use his ultimate skill or something like that. You know what I mean? Like maybe someone messed up and we see this phenomenon in traditional athletes too, is that we use the term a little bit more that we tell people like they're getting in their head. And we'll often say shake it off or something like that, because say you miss a serve in volleyball or something like that, you can't let that get in your head. You need to shake off that error and look to the next play, you look to the next part of the game and not dwell on your errors. And so I think tilting is when you're getting in your head, you're dwelling on those errors and it's affecting your performance moving forward.
Well, thank you for that. Much appreciated. All right, so Sarah asks, how long has esports been active in the athletics department? And then she has a vision question. And I guess, I'll just finish what she's written here. She has a vision question. What should the light setting be? A dark room or a well-lit room? Does it depend? Thanks.
Yeah, so in general, I think a well-lit room will make it more challenging to see the screen better. So if you're watching any professional games, or even if you go into a gaming arena, you'll notice that the lights are down a little bit darker. But I don't think you want it to be completely dark, because then that is causing additional strain, I think, even for peripheral vision. And the light can be a little too bright. So I think it's that healthy balance. I know it's like a weird answer, but it's that healthy balance where your gamers are feeling like they are seeing the screen clearly and they can see what's going on, but that it's not quite so dark that it feels so bright and that it's too dark around it. I don't think there's been any data looking into, like any research looking into optimizing, what is the optimal light settings in the room. I think that's a great idea, though, to look into and see how that affects performance. I mean, there's so much opportunity for any researchers out there to add to the primary literature in this space, because it's really limited and it can be challenging to do, research in general, especially with esports players, because, it's newer and not as many people know about it. But there's so much room here, and I hope that some people that are on this webinar will put out some papers to help inform my care of these athletes.
Awesome. Okay, the next question comes from Michelle. What kind of hearing protection with earphone equipment should these folks use for gaming?
Oh, that's an interesting question. So once again, there's no specific research looking at this, but I do know general recommendations for when you're using headphones, just like in general, if you're listening to music and stuff, is that you should try to avoid being above the 60% volume to protect your eardrums from hearing, from damage. And so I would probably lean on that from prior research from just ear damage from listening to music, and recommend my gamers not increase the volume of their headphones to above 60%.
The next question comes from Heath. He says, very avid gamer here. Has there been any integrations with athletic trainers in the streaming world and professionals? And if so, how can we get involved?
That's a great question. So I would say over the past 2 years or so, I've definitely seen a larger recognition from the esports community on the importance of health and wellness, and of bringing in more traditional sports professionals to help inform their team's overall fitness and performance. And so you'll see certain teams starting to incorporate regular fitness. So Cloud9 is known, very well known for having regular team workout sessions. There's Dark Zero Esports also has regular exercise sessions. You're seeing more and more teams bring on sports psychologists or sports performance coaches and things like that to offer their expertise from traditional sports and implement it in the esports world. So I've definitely seen that. I can't say that I've seen specifically the employment of athletic trainers, but I've seen the employment of physical therapists. Athletic trainers definitely have the skills to be valuable to these teams. And I think we're going to see more of that, right? So as we're seeing more and more of these teams, even at the collegiate and high school level, but much more collegiate level, being absorbed into the athletic department, it's just going to be a natural fit that it's going to come across, they're going to have access to the training room. At this point, they're under the athletic department domain. And so they'll come to your training rooms and see that. If you're looking about getting involved more, it's definitely tough to break in. It helps that you're an avid gamer. So I think that you have the lingo and you have the foundation to break in. There's some great communities to join. So there's the Esports Research Network. They have a Discord channel. I'm assuming you have a Discord. And there's the Esports Business Network to start making connections with persons in those groups. And as you make connections, more opportunities may present themselves. And I think just reaching out, if you know a team that's nearby, a nearby high school, a nearby college, reach out to them, let them know that you're interested, let them know that you've explored some educational content on how to provide care for these athletes, and just try and make that connection. Maybe have an educational session with them for a couple minutes to show them what you know.
Okay, the next a couple of questions here comes from Antoine. They ask, what is a good suggestion on relating to esports participants if you're not too familiar with the games they play? And also ask, what are some of your favorite games to play?
Oh, okay, that's a fun question. How to relate? Well, I like to think of it like this, right? So I'm a sports medicine physician. And I played volleyball in college, so I'm most familiar when it comes to the terminology and the skills that are necessary for playing volleyball. But maybe I played baseball as a kid, but I never rode crew. I didn't really play basketball or anything like that. But but we learn these terms from both working with our players, but also exploring it in our training to gain familiarity with the broad strokes, right? The broad strokes, we know the anatomy, we know the pathology, and that's the same in this population. I mean, it's not like esports athletes are just over here and they're completely separate from regular sports medicine. It's not like that. I mean, in the same human body, and they're having similar issues that we see, you know, even like in our tennis players when it comes to like lateral epicondylosis or something like that. So I think being open to it and asking questions, I think, is a great place to start if you're not familiar. I think there are some good resources online. If you talk with those, if you join, for example, some of those communities I was talking about, they'll post journal articles and things like that. And maybe try and find a game that you like. You also can watch streams, and by watching a stream, you can easily pick up familiarity with terms, right? So say you're going to be taking care of a team and they play League of Legends, you know, you can hop on to Twitch and find a streamer that is playing League of Legends that you like, and you can watch them and you can learn from watching them play, because you'll pick up the terms just like that. So I don't think you have to feel that you need to be an avid gamer to take care of esports athletes, just the same way I was able to take care of basketball players and you know, baseball players and soccer players, even though I didn't necessarily play those sports. As far as the games that I like, so during the initial peak of the pandemic, I got back into loving WoW, which is World of Warcraft. And then most recently, I've really been enjoying Stardew Valley. You know, I work a lot as a physician, and so staying competitive in some of those highly competitive esports really isn't for me, but I really enjoy Stardew Valley. It's a fun game. It is surprisingly poignant. And another game that I love that I play on PS4 is called Rogue Legacy. And one of the reasons I love it is it has medical terminology incorporated in some of the characters that you can play. So you basically, so you can have like peripheral arterial disease as a trait in some of the characters, and so you don't have a pulse, and so you're in your foot, and so when you're running across you know, the game map and playing, you don't activate the spikes because you don't have a pulse in your foot. So anyway, it makes me chuckle, and so I really like that one too. It's fun.
Okay, the Mark's asked a question. I'm not, maybe you understand this. Will esports ever include strategic turn-based video games?
I think there's a room for many different games. I think there's even some talk about including like virtual reality games and stuff. So I think there's definitely room. I think right now we're just trying to break in any way we can, but I think that it's going to continue to grow. I mean, esports aren't going anywhere. They're just continuing to grow and grow and grow, and it's like over $1 billion valuation of the industry at this point. So I think there's a lot of room to grow, and I could see, you know, multiple different areas within that umbrella.
Keenan asks, is there a change in ergonomics when playing controller compared to PC? If so, what would your recommendations be?
That's a wonderful question. There's unfortunately no research looking at recommended ergonomics when you're using a controller, particularly if you're using a console, right? Because in general, when people are playing on a console, they're sitting in a chair but not at a desk, and then the screen that they're using tends to be a television, like a smaller television. Whereas when you're using a PC-based, when you're playing a PC-based game, even though you're using the controller, you're at a computer. So for the most part, most of it is going to stay similar, right? You want your face to be the same distance, that 20 to 40 inches from the screen. You want to make sure that you're not leaning too heavily with your elbows onto an armrest, compressing that ulnar nerve in the cubital tunnel. So a lot of the things that stay the same. The main thing that would be different largely is going to be hand positioning, because you're not concerned with there being like a neutral wrist in the mouse hand because they're holding it. But you still want to make sure that shoulder and elbow positioning are close to the body. They're not winging out and causing that subacromial impingement. And but beyond that, there really isn't any data for recommendations regarding how to hold the controller. But I think in general, keeping those arms close to their body, keeping the controller, if they can keep it down, perhaps in their lap so that they're resting their hands down in their lap without their elbows resting on the armrest, will probably be the best body positioning to prevent injuries in that static body position. Once again, though, we don't want people staying in those static body positions for too long.
Brenna asks, what was the name of the Discord group mentioned earlier? I am also a gamer and would love to connect with other gaming athletic trainers.
Oh, yeah. So one of the ones that I really enjoy on Discord, I'm going on my phone right now to make sure I'm getting the name right, is called the Esports Research Network, or ERN. And it's this great community of academics, you know, from anywhere from like esports people. So from sports medicine people. So like your athletic trainers, physical therapists, physicians. It also is academics like PhDs, researchers, other educational or academic persons, you know, whether they're working in business or not, they're all on there. And there's fun little additional channels for like health, and media studies or psychology and things like that, and people have discussions. And I also really like that there's articles and papers. So whenever there's a new article or research article comes out, someone will post it on there. So it helps me keep track of when new research is being released. And it's a great way to network, and you can reach out, and they basically talk about, you know, if there's guest speakers or just it's a great network, and everyone's really open to meeting with new people. And so yeah, I highly recommend that one. And then there was also the Esports Business Network. That's more, as the name implies, more businessy. They're a good group too, but I really enjoy the Esports Research Network.
Great. We had lots of thank yous, but we are currently over time, so lots of questions there. I'm glad we were able to get to most of them. Thank you very much for your presentation today. You know, very engaging. Certainly, it sounds like there's a lot of gamers that attended. There's also a lot of folks who are coming in with less knowledge, so it was a good mix for all of the above. I really appreciate that.
Thank you so much for joining. If you have more questions or want to reach out, please feel free to take down my contact information. I'd love to hear from you.
All right. Have a great night, everyone.
Thank you.